In tonight's wellness report, for some women, no matter how much they exercise, their stomach is never flat after having a baby.
As one mother found out, there may be a medical reason for that, and all that exercise might actually just be making things worse. NBC Boston health reporter Christy Lee explains.
It's called Diastasis Recti. That's when the stomach muscles separate because of the organs pushing against them. It happens to women during pregnancy, but the problem is the gap doesn't close for everyone after. Kimberly Emmerling is in the best shape of her life, but for years her stomach didn't match the rest of her body.
I looked like I was 9 months pregnant.
Even though she was doing CrossFit 5 to 6 days a week.
All the crunches, planks, anything that was thrown my way, I was trying to flatten my stomach.
Turns out those were all the wrong exercises because she had diastasis recti. DR is when the muscles on either side of your stomach parts because of organs pushing against the connective tissue that holds them together.
That layer is what keeps the insides in and everything else out, and that's also what makes the abdomen look flat.
Dr. Daniela Carusi of Brigham and Women's Hospital says it happens to almost all women during pregnancy, but
about 30 to 40% of women may permanently have some separation there after a pregnancy.
DR can cause low back pain, urinary incontinence, and constipation. But for most, it's just cosmetic, and surgery can fix it.
Hey, how are you? Good. How are you? Good.
But Kim didn't want to go under the knife, and in February found Caroline Johnson a belly rebuild in South Weymouth.
It offers people a way to heal a diastasis recti non-surgically.
Johnson teaches the Tupler Technique, one of several programs developed by DR experts. It involves wearing a splint 24/7.
The purpose of the splint is to reposition the muscles back to where they should be, and then exhale back to fifth.
And breathing and abdominal muscle exercises for 6 to 18 weeks, depending on the size of the diastasis. For Kim, it was 15 weeks. If you think you have DR, here's how to check.
You'd have your fingers pointing down towards your pelvis. Okay, you're going to bring your fingers in and then lift your head up slightly and then lower it down.
With DR, there is a gap between the muscles at least 2 to 3 fingers wide. Kim's was severe at 6 fingers.
In terms of everything, it's just giving me more confidence, it's giving me a happier body image, and I feel good. It's an actual physical good feeling.
Now, it's not a permanent fix. You don't have to keep wearing the splint, but you do have to avoid the exercises like the crunches and the planks. And there are also physical therapists who specialize in closing the gap. Christy Lee, NBC Boston.